confusing, isn't it? I mean, I get confused when I read all of this stuff. But having done this long enough now, it's my intention to clear this stuff up for you. I want to make this as plain and simple for you to understand that, again, we're falling into the game of numberosis. Hey, everybody, it's just Dr. Jack here today. Mary is so focused on finishing up her book to get it ready for the copy editor that she suggested I go ahead and do this podcast by myself because we agreed to get more out with just audio, and I decided to go ahead and do it. After all, radio has been my comfort zone for over 25 years. So welcome back to the Forbidden Doctor podcast. This is episode 140, the deadly vitamin D hysteria. Now, this podcast is not intended to be a diversion away from the current system of disease management. It's our intention, my intention today, to offer a rational, very effective approach to aiding your body in its ability to rebuild and heal itself. Please be advised that any suggested nutritional advice or dietary advice is not intended as any primary treatment or therapy for any disease or particularly prominent bodily symptom. I mean, nutritional counseling, supplement, vitamin recommendations, nutritional advice, and the adjunctive schedule of nutrition is provided solely to upgrade the quality of foods in the patient's diet in order to supply good nutrition, supporting the physiological and biomechanical processes of the human body. So, let's just get started here. Yeah, I want to be talking about vitamin D3 and the hysteria out that's, there's one fad after another. I mean, I should say fraud. There's one fraud after another piling up. Well, piling up is a good word. I mean, the frauds are piling up like manure in a barnyard. And we've talked about many of these in the past. The antioxidant free radical pathology hoax, the vitamin C ascorbic acid hoax, the mega vitamin hoax, the vitamin E tocopherol oil hoax, the vitamin K2 supplement hoax, the water-soluble chlorophyll hoax, the methylfolate MTHFR gene hoax, and the alkalize or dialkaline water hoax. I mean, hoaxes and scams, all of them. And now, if that is not enough, here comes another one, the vitamin D3 hysteria. And if you haven't noticed, there is, being a doctor in a clinical setting in my office along with Mary, there is this mass vitamin D3 consumption hoax that's going on out there right now. One of my doctors who I consult with is recommending as many as 50,000 units of vitamin D to his patients. And some of you have received a prescription from your medical professional and are taking up to 50,000 units of vitamin D every day because you might have demonstrated some level of bone loss. Now, maybe you took one of those ridiculous DEXA scan tests to determine bone density, and because the comparison of your bone density to an 18-year-old female was less than hers, and that's what the comparison in these DEXA scan tests are based on, an 18-year-old female. And so, as a result, your doctor, who knows nothing about nutrition, scared you into taking a ridiculously high level of vitamin D without ever knowing that can kill you. And that's what we're going to be talking about. That's what I'm going to be talking about in this podcast, because there are several things wrong with that test. Because they'll often test an area that's not weight-bearing. And your bones are not evenly dense. I mean, their density is based on how much weight they carry. The more weight, like your lower legs, the greater the density of the bone for obvious reasons. And also, that test only measures bone density. It doesn't measure bone strength. And it's not the mineral matrix in your bones that gives your bone strength. It's the protein present in the form of collagen fibers. Remember, bone is made of three things. It's made of water. It's made of mineral complex, mostly calcium and phosphorus, and protein in the form of collagen fibers. So the test right now that goes on for vitamin D, it's now the fifth largest lab test in the hospital. It's preceded by cholesterol as the fourth most popular test. And vitamin testing in a hospital setting for any vitamin, especially, and by hospital, I mean the laboratories, the lab testing that goes on, and usually it's connected with a hospital, but vitamin testing in this kind of a setting for any vitamin, especially D3, is very unreliable because some people are very efficient in their vitamin usage and others aren't. And here's the important test. If you are functionally deficient in vitamin D, you're going to have hypocalcemia. You're going to have low blood calcium, and which is contrasted, of course, by too much of the parathyroid hormone that can stimulate osteoblastic activity, the building of bone in the bone marrow to raise blood calcium is what happens. And when we get too much of this parathyroid hormone, it's usually from a tumor on the parathyroid gland, and we can usually see unusually high levels of calcium in the blood, and not because we have too much vitamin D. So that I'm contradistinguishing elevated levels of vitamin D in the blood as opposed to a tumor on the parathyroid gland that can cause the same thing, but that's kind of rare. So too little vitamin D, you're going to have low blood calcium. Simple enough. I mean, you'll have low ionized calcium as well, calcium bicarbonate, which is the liquid form of calcium in your body. So, and the principal job of vitamin D is what? Well, it's to bring calcium from the gut, from the tissues, into the bloodstream. So that is the real test. Is low blood calcium. And what also goes with low blood calcium, you're going to have muscle cramps. You're going to have muscle weakness. You're going to have recurring fevers in children. You're going to have muscle twitching, canker sores, restless legs. Those are the signs of low calcium, as well as something else that I'm going to get to later in this podcast. But the important thing is that the vitamin test by itself is very incomplete, because I need to see serum calcium and ionizable calcium. There's other numbers that I need to see besides vitamin D3 level. And I want to see the calcium phosphorus ratio. According to Dr. Melvin Page, it should be 10-4. And so if you do not have an effect present, how can there be a cause? If you're not having a symptom of low blood calcium, why would you be taking large amounts of vitamin D3? I mean, it's pointless to test something unless a case is present. And if you are vitamin D deficient, number one, you're going to have low blood calcium. If you do a blood test for any reason, thyroid panel, whatever else, and it shows calcium levels are normal, you don't need heavy supplementation of vitamin D3. Even if a DEXA scan is showing that you have less bone density than an 18-year-old girl. Now, something here from the Harvard Medical School in the work of Dr. Monique Tello, who was researching 25-hydroxy vitamin D levels. And this is back in 2010. And they decided back then on a blood test for calcium that the normal is about 20 nanograms per milliliter of vitamin D3. And as we often see in medical research, just a year later, 2011, the respected Endocrine Society issued this report that urged a much higher minimum level of vitamin D. And so this society's clinical panel of experts who was involved with the 2010 study, some of them, decided to create a vitamin D task force. And they concluded, and this is from their study, quote, "We now recommend vitamin D levels of 30 nanograms per milliliter. And because of the vagaries of some of the assays, they went on to say that it should be 40 nanograms of vitamin D per milliliter for both children and adults." And so it turns into this arms race, higher and higher, bigger and bigger, larger and larger, because if they can test it, they can find a reason to play with it. It's just like the continually lowering recommended cholesterol levels that are going on since the early 1980s. To sell more and more statins, they keep lowering the level they think cholesterol should be. Well, with the vitamin D, they want to increase the vitamin D levels. They say, well, it should be here. No, it should be higher, so that they can continue that profession. Now, Dr. Monique Tello from Harvard Medical School goes on and says, wait, there's more, as if it was some late-night television commercial. A new, more correct, she said, target level on vitamin D is presented in this new article from the New England Journal of Medicine. Vitamin D deficiency, is there really a pandemic? And in this piece, several epidemiologists and endocrinologists who had recently published the study with over 2,000 perimenopausal women who had been followed for almost 10 years. And then they found that the vitamin D levels, less than 20 nanograms, which was the first suggested level, were associated with a slight increase of non-traumatic bone fractures. Then they concluded that the vitamin D levels for a menopausal woman in midlife should be less than 20 nanograms per milliliter. And for the mass majority of many individuals, maybe 15, maybe 10, they said, was perfectly fine. Confusing, isn't it? I mean, I get confused when I read all of this stuff. But having done this long enough now, it's my intention to clear this stuff up for you. I want to make this as plain and simple for you to understand that, again, we're falling into the game of numberosis. Let's alter your physiology to match some normal across the country, rather than finding out something about your physiology. And you can see that this confusion is getting worse. I mean, now they're down to 12.5 nanograms per milliliter and even down to 10. And why? Why are they raising it? Why are they lowering it? Then lowering it even more? Well, because there's some huge anomalies here. Because if you're spotting a true vitamin D deficiency, you've got to demonstrate the effect of that cause. And what would be the evidence of a true vitamin D deficiency? Now, I already gave you the answer. I mean, we all know that there's no effect without a cause, and that all causes have an effect. Otherwise, it wasn't a cause, right? So if a cause is a vitamin D deficiency, what is the effect of that? Well, the effect is hypocalcemia, low blood calcium. It's that simple. I think it's easy enough for everybody to understand that. If you don't have low blood calcium in a blood test, why would you suspect that you have a vitamin D deficiency? You see, the major function of vitamin D is to draw calcium from the gut, sometimes from the bone, into the blood. But for our purpose today, that is virtually the entire function of vitamin D. There's other things vitamin D does. It inhibits angiogenesis inside of a tumor. In other words, it inhibits the growth of blood vessels inside of cancer tumors. But that's a subject for another podcast. But rickets, we don't see too much of that. Mary and I saw somebody like that the other day. And it was actually a rather well-dressed woman, middle-aged woman, and her legs were bowed. And when you have rickets, for example, as a child, which is a classic vitamin D deficiency, the bones of the baby do not develop properly. And that's where you get that signature bowed leg appearance. I mean, the calcium never gets into the bones during development, so the bones have that rounded shape in the legs and elsewhere. But nobody calls that a calcium deficiency. They refer to rickets as a vitamin D deficiency. You see, the calcium isn't to blame. It needed the vitamin D to be absorbed. Calcium can be in the gut, but if your vitamin D levels are low, you're not going to absorb the calcium. And how does that show in a blood test? Low blood calcium. So let me ask you a question which most likely you don't know the answer to, which is why I'm going to ask the question. Why is it that African Americans and the Africans in Africa, so both African Americans and African Africans, are well noted to have the strongest and healthiest bones of any racial group on the planet? I mean, it's indisputable because it's measurable. So we know that the least amount of osteoporosis and the accompanying, the loss of the bones in the mouth, the gum problems, the loss of teeth, skeletal problems, all of these bone health is least in African Americans and the African community in Africa. And yet, universally, in Africa and in America, Black Americans and Black Africans have the lowest vitamin D levels of any race. It sounds counterintuitive, doesn't it? Like you have to have high vitamin D to have strong bones. That's where a lot of this conundrum comes in, because the lowest vitamin D levels measured. This turns up because many African Americans are being tested by their doctors for vitamin D, and then they're given all kinds of vitamin D supplements when their vitamin D levels show below the 30 or 40 nanoliter or nanogram per milliliter level, and then all kinds of serious problems start to be noted in the African American community. And then all of a sudden, it began to dawn on somebody that gee, you know what? African Americans have the strongest bones in that racial profile that we know of. But they have low vitamin D. What's going on? And then they began to find a similar thing, not only with African Americans, but with Latino Americans, Mexican Americans. So that in the June 2011 edition of the Osteoporosis Journal, a peer-reviewed medical journal, the headline study was, quote, racial differences in the relationship of vitamin D bone mineral density, parathyroid hormone, and National Health and Nutrition Exam Survey. That's quite a title. And so the relationship between the 25-OHD, that's the designation for the vitamin D, the relationship between that bone mineral density and parathyroid hormone differed, as in blacks compared to whites and Mexican Americans. The blacks and Hispanics have much lower 25-hydroxy vitamin D in their blood test concentration than whites do. However, it's unclear, whether these levels are considered optional for bone and mineral metabolism in white, and or is it the same for other kinds of populations? Now, I'm going to get really technical here for a second because some of you might be looking for this, because there's a lot of conversions that take place inside the human body in dealing with vitamin D, because vitamin D, there are epidemiologists, endocrinologists out there that want to call vitamin D a hormone. They don't think it should be referred to as because it's steroid-based, they don't think it should be referred to as a vitamin. It's steroid. In fact, they say it's the most powerful steroid-based chemical in the human body. And so when you take in vitamin D, either through supplementation or cod liver oil or Cataplex D or the synthetic stuff that they have out there, you're taking in something that's called 25. What they're trying to measure in the body is this 25-OHD, and it's really a pre-hormone that's produced in the liver by a process called hydroxylation of the cholecalciferol. You might take into your body something that's called cholecalciferol, but even that has to be changed in the body by enzymatic action inside the liver. And so, and this is how they measure this stuff, because physicians worldwide, laboratories worldwide will measure this metabolite to determine your vitamin D status. And at a typical daily intake of vitamin D3, its full conversion to what's called calcifediol takes about 7 days. So if you took a handful of your prescribed vitamin D and swallowed it down, it's going to take 7 days before it has an actual vitamin D effect in the body, because the calcifediol is then converted in the kidneys by another enzyme into something called calcitriol, which is another form of the hormone that is the active form of vitamin D, the calcitriol. And it can be converted into something else by a bunch of other methods. But I wanted to mention that because it's not like taking vitamin A or whole food vitamin A, vitamin C, vitamin E, vitamin K from green leafy vegetables, where that vitamin is absorbed and it's used by the body right away. Vitamin C used right away. Vitamin E, vitamin A. Vitamin D is a very complex molecule, and it has to go through several changes before it gets to a form where your body can actually use it. So, and I tell you these things so that you'll understand that there's something more going on here than just getting a blood test. And yet, as compared with whites, blacks have much higher bone mineral density and and what they call the fragility fraction, the ability of a non-trauma bone to break, like in a hip fracture. We get this idea that older ladies will fall down and fracture their hips when the evidence shows that the hip fractured before they fell down. That's what caused them to fall down. But as women will go through menopause and their whole hormonal structure that has an awful lot to do with osteoporosis changes, we find out that whites are more susceptible to these kinds of fractures than African Americans are. And on the basis of the current guidelines that suggest this threshold of 20 to 30 nanograms per milliliter of vitamin D, 77 to 96%, and this I'm referring back to that study I mentioned a minute ago, the black participants would be classified as vitamin D deficient, based on the fact that they should have somewhere between 20 and 30 nanograms of vitamin D per milliliter in the blood tested. Even though they have the hardest, strongest bones, least susceptible to non-traumatic fracture, they would be considered being vitamin D deficient because their blood didn't match up with what is considered to be the normal. Now, labeling the majority of black participants as vitamin D deficient would be inconsistent with the observation, obviously, that they have higher bone mineral density, higher blood calcium levels, and only slightly elevated or higher parathyroid hormone levels than their white counterparts. So how do you explain that? I mean, because your vitamin D3 blood test is not going to explain this. Well, it seems to me that vitamins should, by their very nature, not have a racial preference. And it's simply this, that some people utilize vitamin D more efficiently than others. And what would you expect then, again, from a vitamin D deficiency? You're going to have low blood calcium. You're going to muscle cramps, cavities, dental caries, osteoporosis, cold sores. And I'll try to get to the relationship between low blood calcium and cold sores. Actually, I'll just tell you now, cold sores are a gift from nature for some people because it tells you your calcium levels are low. Calcium, just increasing your calcium is one of the fastest ways to prevent cold sores, but maybe I can get into more of that. But muscle cramps, restless legs, muscle spasms, things that would indicate that you're not absorbing the calcium. And you say, well, I eat a lot of green leafy vegetables and I eat a lot of stuff that has calcium in it and I'm drinking milk and I get all these symptoms. Well, that's an indication that your vitamin D levels might be low rather than a blood test. And then, of course, there's something else, and that's something very else. Here often, we've been talking about getting too little vitamin D and what you need to up it. But these medical doctors, remember this, as good as they are in life-saving procedures in the emergency room in hospitals, they don't know a hill of beans about real vitamins. They simply don't. And I hate to say it, and I hate to paint it with too broad of a brush, but I don't think you can in this case. The medical profession has been absolutely AWOL, pathetically absent without leave when it comes to the entire subject of nutrition. I mean, they have been wrong on the side of every nutritional issue for the last 120 years. And what medical people are not up on, they're down on. And because they do not study nutrition, they do not understand it, because they know essentially nothing about it, and they dismiss it as having no relevance. And so here, I'm talking about giving vitamin D supplementation for a supposed vitamin D deficiency, which has no measurable effect in that there are no visible signs of low blood calcium, yet a blood test might show against a normal low vitamin D. I mean, this is crazy making. That's why I refer to this as another scam. The vitamin D hysteria is just another scam. And so what happens then if you go ahead without symptoms, except, they might be minor. Maybe you got some muscle cramps. Maybe you've got some dental problems, and the dentist says, you ought to increase your vitamin D. Well, how much, doc? 50,000 units a day. Or you do a DEXA scan if you're female. I don't know any men that do that, but I suppose there are some. You do a DEXA scan, and it shows, your bone density isn't as dense as it should be. I want you to start taking high levels of vitamin D. What happens when you start taking all that vitamin D? Are there downsides to it? And of course, this is where I'm going. And I think you don't have to go any further than a 2004-2005 study when a tremendous observational study came out of Holland, written by a Dutch medical researcher. Of course, that goes without saying. And what does he say? I mean, what's his observation? That the summer sun increases a woman's chance for papillomavirus infection. Now, the HPV virus, and you've heard a lot of that in the news lately, especially with the vaccinations and the risk of an HPV vaccine, is the number one cause of cervical cancer worldwide. Now, this is something else you may not know. The human papillomavirus, the HPV virus, has been found, and here's a study, and it's talked about in the New York Times February 22nd, 2016 article. Over half of Americans are infected with HPV. Now, I'm not saying this to scare you, because most cases of HPV, it ends up being nothing at all. I think it's 9 out of 10 cases of HPV it will disappear in a short period of time. Even if you got a test right now, oh my gosh, you got HPV, we got to start. Just wait. 9 times out of 10, 90%. That's a good average to take into Las Vegas. 90% of the time, it's going to amount to nothing. But what are they saying here? More than 42% of Americans between the ages of 18 and 59 are infected with genital human papillomavirus. Now you're wondering, what's this got to do with vitamin D3? Well, stay with me. Because according to the first survey to look at the prevalence of virus in the adult population, the very first one, 42%. Now that report that came out of the National Center for Health Statistics also found that certain high-risk strains of the virus infected 25 beyond the almost half of all men and women. But in a 25% of men and 20% of women, a high-risk strain of the virus was also found. And these strains, of course, account for, according to this research, 31,000 cases of cancer, cervical cancer every year. So they say that 25% of the men in the country, a little less of women, just slightly over half altogether, have the human papillomavirus in their bodies. Now, obviously, most of them do not come down with cervical cancer. A lot do, but like with all viruses, like the herpes simplex virus with cold sores, you literally open up the body toward an invasion by bringing that virus out of dormancy when you trap too much calcium in the blood, and the calcium in the tissue is depleted, where your immune system needs that calcium to destroy that virus. Calcium is the most antiviral element inside your body. I've talked about this in other podcasts, but a research project that was done and published in 2003 at Lawrence Livermore Laboratories, where the federal government tasked Lawrence Livermore Laboratories in Berkeley, in California, to weaponize plague. Now, you got to wonder why they were thinking that, but they wanted the plague weaponized. And part of the results of that study was the plague would not take place in mammalian tissue with high calcium content. Not high calcium in the blood, but high calcium in the tissues. So if there was high fever and high and low calcium, they were a dead duck for the plague. If there was low body temperature, normal body temperature, and high tissue calcium, it didn't seem to have that much effect. Well, that's a virus like this. I mean, one of the seminal teachings or trademarks of Dr. Royal Lee and Standard Process is that the understanding of calcium can't possibly be complete without the understanding and the role of vitamin F, F as in female. Because it's not a problem in a matter of getting calcium into the blood. The challenge is to get it into the tissues where it belongs. It's in the blood. Vitamin D brings calcium out of the gut into the blood on a transient basis, to move it around, just like you take a bus. You take a bus to deliver your body to another place, but the bus is not the goal. The bus is the transitional aspect. The blood is a transitional aspect of the calcium. The calcium doesn't do a whole lot good for you in the blood. It helps with clotting factor, that's true. But you want the blood you want the calcium out of the blood in the tissues. Much less than 1% of the calcium in your body, the entire total calcium content, less than 1% should ever be in the blood. But when you start loading up with vitamin D, you cause a hypercalcemic reaction. In other words, much increased levels of calcium in the blood. And so you end up trapping lots of calcium in the blood at the expense of tissue calcium, at the expense of bone calcium. It's like trapping people on a bus, and it takes them to where they want to go, but they can't get off the bus because the door's locked. Without sufficient levels of vitamin F, which the FDA recognized a few decades ago, but now they just say it's a fatty acid. And the vitamin F, Cataplex F that Standard Process makes, is a distilled form of those fatty acids to get a concentration of a certain aspect of those fatty acids that push calcium out of the bloodstream into the tissues. And so those three viruses that I just mentioned were much worse in the summertime. And it didn't matter where in the world you are. I mean, it could be July and August in the northern hemisphere, January, February in the southern hemisphere, but the exact same phenomenon because the seasons were reversed. But what the study showed was that during the summer, a good old virus like herpes simplex virus, along with the HPV virus, goes massively active in the summertime. It could be in a dormant state during the winter, but when the sun comes out, they go massively active. Now, what happens in the summertime that doesn't happen in the wintertime? Vastly more exposure to sunshine. And sunshine with its ultraviolet rays, particularly ultraviolet, the UVB rays, causes the cholesterol in your skin through irradiation to convert into vitamin D. And so that the most efficient vitamin D creation that you'll ever experience is not what you ingest from a supplement, but what you convert in your skin into your own internal vitamin D through a photosynthetic effect of the UVB rays against cholesterol, beta cholesterol, underneath the surface of the skin. So what is that doing? Well, it's building up the level of calcium in your bloodstream. And it not just pulls calcium from the gut into the bloodstream, it pulls calcium from the tissues into the bloodstream. And so now, starting back in 2004, then much later in 2009, they observed the influence of these viruses when people were exposed to lots of sun. So much so that they make this crazy, stupid, idiotic statement, quote, "The sun is a kind of drug, a drug that influences whether a papilloma infection takes hold or not," end quote. Can you believe that? They want to call the sun a drug because suddenly, with exposure to the sun, your chances of a dormant HPV, a dormant herpes simplex cold sore, becomes much stronger or much more prevalent and virulent and starts showing up. So that's the lead author of the study, Dr. Hiroshi, this Dutch authority on this. He calls sunlight a drug. But we all know if you've been listening to me, and you're still listening to me in this podcast, you know where this is going. You know what the answer here. It's the vitamin D. Nothing really mysterious here. I mean, you can see that vitamin D is massively elevating in the sunlight through the sun exposure in the summertime. And this is when these viral infections become much more active. I mean, anybody who has a problem with cold sores, you have more of them in the summer than you do the winter. And you would think that the usual concept of viral infections would be worse when people get all huddled together indoors in small rooms. I mean, where they're much more likely to come in contact with someone who's sneezing and coughing or just being in a closed room. And in the winter, and that you would think that the contagion of virus would be much worse then. I mean, how many of you get summer colds? I had 2 people in my clinic just this last week that came in for my care, but they were suffering from and they say, "Oh, it's just another summer cold." And I'm sitting there thinking, well, I say, "Are you?" And you can tell by their skin. They've been in the sun. You working in the garden? Yeah. Have I talked to you about Cataplex F? What's that? Oh, shame on me. But actually, it's much worse in the summertime because the vitamin D levels are elevating your blood calcium levels beyond a safe level. And consequently, if you don't have enough vitamin F, which is the antagonist of vitamin D, to drive the calcium back into the tissues, you're going to activate everything from a simple herpes canker sore all the way to HPV. And an HPV diagnosis is much, much higher in the summertime, as was polio, mind you, but that's another story. And by the way, as I said, people who are bothered by cold sores, you get it more in the summer than you do the winter. I know I'm repeating myself, but I just want to try and make this point very clear to you. And so here you see that vitamin D overexposure is as dangerous, if not more dangerous, than low vitamin D. I mean, you don't want it to be high or low. You want it to be right. But these artificial measurements of where, if you don't hit 20 nanograms per milliliter, my goodness. Well, let's just start loading up on vitamin D, particularly vitamin D3. And by the way, vitamin D2 should never, ever, ever be considered. It's, irradiated ergosterol, and that is a toxic form of vitamin D if there ever was for humans. Back in the 1930s, it was called biosterol, and it could easily cause hypercalcemia. Hypercalcemia being too much calcium in the blood, which if prolonged could cause calcification of the kidneys. But vitamin D3, the natural form, can also be toxic if you have a vitamin F deficiency to balance, especially in the summertime when you are in the sunlight a lot. Our son who played high school football, they start practicing in August. And we said to him, every morning, I want you to chew up about a dozen of these Cataplex Fs tablets before you go out there in the heat. And day after day, the kids, because they've been sloughing off all summer long and haven't really done a whole lot unless they've gone in for weight training in the gym, the kids that want to play football, they're puking their guts out. And they're being threatened with sunstroke. He didn't. He never vomited once. Because his internal temperature regulation, which is necessary for calcium in the tissues to take place, not in the blood, but in the tissues, kept him from that kind of a problem. So a vitamin F deficiency is far more frequent than a vitamin D deficiency because unlike sunlight, we have no way of exposing ourselves to something that will cause us to make vitamin F. So we have to get it from the essential fatty acids in our diet. And in many cases, convert the omega-3s into vitamin F inside the liver. So to give you an idea of how toxic vitamin D3 can be and vitamin D2, and I talked about it because it's the synthetic stuff, vitamin D2, and it's super, super toxic in humans. I mean, even vitamin D3 is toxic in humans and other mammals if you get too much of it. Now, I hope I'm not frightening anybody, and it's really my concern as part of the Forbidden Doctor with Mary to quell fear and anxiety and concern and replace it. I don't leave a vacuum there. Replace it with an understanding and knowledge of what's really going on here so that you can take care of yourself. And so with that in mind, here's another one of those things. Just like I was talking about the African Americans having the strongest bones, the highest bone mineral density, the fewest fractures, and at the same time recognized as having the lowest levels of vitamin D, and here's the problem, if you give them much more vitamin D, trying to bring them up to some national average of what a blood test should be, you will actually be hurting their bodies because they'll end up trapping calcium in their blood. Now, as I mentioned a few moments ago, vitamin D3 is known chemically as cholecalciferol, vitamin D3. Cholecalciferol is what standard processes vitamin D is, natural vitamin D3, not synthetic, but natural. And well, as you know, because I'm sure you don't, and you may want to make note of this, vitamin D3 is so effective at trapping calcium in the blood that it is an extremely potent and ever more popular pesticide for mammals. That's right. Vitamin D3 now is being used, not now, it has been for a while, as a pesticide. Now, before I get into the poisonous aspects of too much vitamin D3 used as a pesticide, I want to one more time bring up the free symptom survey that we offer at forbiddendoctor.com. This is a reminder that your own personal health profile requires more information than a simple blood test. This survey has many questions, most of which do not apply to you. In fact, for most people, less than 20 questions have actual relevance out of the whole group of them to your situation. But those 20 answers could give or provide us with a wealth of understanding as to what course we would recommend. And that recommendation comes in the form of a 30-minute phone consultation, all of this at no charge to you at forbiddendoctor.com. So let me get back to the podcast. Now, as I was saying, cholecalciferol is an acute, fatal feeding rodent bait. Why? Because vitamin D3 will rob the calcium, high levels of vitamin D3, not a little spot of it. High levels will rob the calcium from the bone matrix and it puts it into the plasma, into the blood, and it results in death by hypercalcemia. Too much calcium in the blood. After one lethal dosage, rodents stop feeding due to the rapid onset of the symptoms. And the name of these particular pellets, you can Google this. The name, the active ingredient in these pellets on this pesticide container is cholecalciferol, vitamin D3. Now, cholecalciferol has low toxicity to birds, which is one of the reasons why they really prefer using it to kill voles and squirrels and chipmunks and possums and mice because they die quickly from an overdose of the vitamin D3, cholecalciferol. Their blood turns into this hypercalcemic rock. The kidneys calcify. They can't get rid of the fluid and they die quickly. Now, if it was a regular kind of a poison, then some raptor might come along and eat what the pesticide-laden rodent was dying from, and they would get that poison in themselves. And this happens all the time. But since vitamin D has very little effect on birds, I mean, they're essentially immune to it. So if they were to eat the carcass of a squirrel or a chipmunk or the mouse, whatever, they'd unlikely be poisoned by it. So here's an interesting study to back up what I'm telling you about. It's from a few years ago from New Zealand. And again, I'm doing this to hopefully allay your anxiety that somebody scared you into taking high levels of vitamin D3. Now, New Zealand, you may know or not, is this beautiful group of islands in the South Pacific that has no predators. No snakes, no predators. They have to be very careful when they introduce a new species because they can quickly become overrun because there's no limit on the species by predator present. So this is what happened with possums. The islands started to be overrun with possums. So they created this vitamin D3 cholecalciferol gel, which they stapled to the trunk of a tree, and they were able to massively wipe out in a very short time their possum population. Now the study called, quote, field efficacy of cholecalciferol doping for possum control, end quote. Now, of course, the takeaway money line in the conclusion is this, quote, it would appear, therefore, that cholecalciferol vitamin D3 gel bait represents and presents a promising option for achieving long-term control of possum population. That was published, the Royal Society of New Zealand, in the journal New Zealand Journal of Zoology. So this is some serious stuff here. And I guarantee if you call up a local pesticide company, and let's say you've got voles in your garden, and I don't know if you know what a vole is, but we have them in our house. We're on the edge of the wilderness. And voles look like a mouse with no tail. And if you have voles in your garden, they're going to eat your root vegetables. They're going to eat your beets, your carrots, your potatoes, because, well, they just have this extensive underground tunnel network. And these little voles go around and they just demolish all of your root vegetables. So if you don't want to, well, by the way, you're never going to see one. I mean, you may have 100 voles living in the proximity of your yard, within an acre anyway. And other than the destruction of all your root vegetables and some mounds where they have dug these little escape holes, you're never going to see a vole. You could live there 20 years. You could go out with a flashlight at night and you might see one. But they're doing their work. And if you can't get rid of them, then you use the vitamin D3 bait. The same vitamin D3 you might be taking as a supplement because it turns their blood into this hypercalcemic state. It clogs their kidneys and it kills them, and there's no two ways around it. Now, this is what happens to humans when they overdose on vitamin D3. It brings so much calcium into the blood from the gut and the tissues that the body has to do something with all that calcium. And so it starts dumping it into the kidneys and the blood vessels and the organs and the vessels of the heart and the joints, which we call arthritis, and the eyes. Yeah, the eyes, it's cataracts. Cataracts are calcium. But the kidneys are the most dangerous, as calcification of the kidney is a very real thing and can lead to kidney failure. So this shows what I'm going to do now. I want to add this kind of what I'm talking about, because if you listen to a vitamin D researcher, Dr. Royal Lee, he says the same thing. Now, here's a transcript from the early 1950s, and this is a transcript of a part of a recording. And he's answering a question from someone in the audience toward the end of his lecture. So I'll start with the question, Dr. Lee. Are there any contraindications in using vitamin F in preventing sunstroke? Answer, no. You can't get too much vitamin F. It's completely non-toxic. You may need 3 or 4 tablets a day several times, like I was talking about my son playing football, if you're out in the sun all day. Vitamin D is toxic, as you well know, and if you get it from ergosterol D2, the synthetic vitamin, or whether you get it from the real thing, too much sunlight, it's problematic. Because when you develop the sunstroke, this is still Dr. Lee here, because when you develop the sunstroke, you're suffering from the toxicity of hypercalcemia. It isn't quite as bad, the sun vitamin, compared to ergosterol. When it's naturally produced, it will not produce as quickly calcification of the kidneys as the viosterol will. I've seen hundreds of youngsters with calcified kidneys. He continues. Any infant or child that reports with blood in the urine, you can depend on it that it is viosterol, vitamin D2 poisoning. I don't know of any other case in youngsters. It's very common. Take them off the vitamin D2 and give them a little vitamin F and calcium lactate and some vitamins A and C, and you can control it. You can stop it. It takes a lot of vitamins A and C to heal up those kidneys because they're calcified to an extent that you can see them on an X-ray. It takes weeks or months to get rid of it. That's a very common thing. Now, apart from what he's saying here, I've seen calcified kidneys on X-rays with some of my patients. He continues, I recall one of our boys was drafted, and his wife wrote him when he was overseas about one of their 3 youngsters that developed blood in the urine. And he wrote back and said, where in the devil are you getting Viosterol from? And she looked on the label of one of her bottles that the doctor had prescribed and found that there was Viosterol in it. She didn't suspect it because he had warned her before he left when he was drafted about giving any poisoned vitamin to the kids. And that's how specific this is. If you're looking for that reaction, you'll find plenty of it, end quote. Dr. Lee from the mid-1950s. Calcification of kidneys in children is a very, very serious thing, and it goes back to this very thing. Now, this is me now. We don't use the word Viosterol anymore. We use ergosterol, D2 or ergosterol. Now, if I ask for a show of hands how many people know that vitamin D3, cholecalciferol, which you've been probably taking in a supplement on a regular basis, used at very high levels, is an EPA-registered pesticide? Well, I would say practically none of you. Well, Google cholecalciferol and pesticide and see what comes up. I mean, you'll find that your local happy pesticide man uses it on larger rodents and mammals because they're concerned about not passing the poison up the food chain to susceptible birds. And how many of you knew of the people who have the strongest bones, the skeletal structure, the African Americans, unless they've destroyed it through pure garbage junk food and eating lots of sugar, for example, the strongest bones on the planet, and yet African Americans and Africans from Africa have the lowest levels of vitamin D. I mean, it flies in the face of all of this hysteria. And yet if you look at, by the way, whenever people send me their vitamin D levels, I say, you've got to send me the rest of the blood test. Particularly, I want to see your calcium and phosphorus levels. I want to see your ionized calcium levels. And what I have found, patients in good health, but they're showing up with these low vitamin D tests, low nanograms per milliliter, below 20. And their doctors are giving them prescriptions for vitamin D because they want their blood levels up to 30 or up to 40, yet the doctor never looked at phosphorus levels that balances the calcium. They never look at the ionized calcium, which is the indication of calcium in the tissues. And yet these people are fine. They don't have hypercalcemia. And yet they're being prescribed huge levels of vitamin D3. And remember the Melvin Page's magic number of 10 to 4, calcium to phosphorus. In this one test, 9.9 calcium, 3.8 phosphorus. That's 10 to 4. You want that ratio about 2.5. You want 2.5 times as much calcium as phosphorus in your blood because they balance one another. So you see how high toxic levels of vitamin D can be. You don't want to be deficient in vitamin D. I mean, nobody's saying that. But you should look for the downstream effects of vitamin D deficiency rather than a blood test. And nature provides them, obviously, everything from dental cavities to muscle cramps to nervous twitches to hyperirritability, and in children, the sudden onset of fevers spiking up and down. That's tissue calcium starvation. And if you want to make it worse, just give them vitamin D instead of vitamin F and add to it when they're sick. Add calcium and vitamin C. That's what they really need, the F, the C, and the D, or the calcium. That's the triad. We have a podcast on that. Earlier in our podcast history, Mary and I did a lot on that very subject. But you sure don't want to end up like these possums in New Zealand. Within a few hours of a massive overdose, they calcify their kidneys and they can't move their urine and they die. Now, hopefully, I have disabused you of the fear that you need to keep taking these ridiculously high doses of vitamin D to hit these artificial targets, which the medical doctors themselves are all over the place with these numbers. High of 50, now they're down to 10 or 12 and a half. And all of this from the Harvard Medical School. Dr. Monique Tello of all places, Harvard. And what they're saying is, is look for the signs. That's what they say now. Look for the signs. Well, that's what I've always been saying. That's what Mary has always been saying. So there's a test called the calcium cuff test. It's the number one test for hypocalcemia. It's 96% accurate. We do it in the clinic all the time. You just put a blood pressure cuff on the calf of the leg and you pump that thing up to, I think, like 220, an indication of 220, and you hold it for a few seconds. If the leg does not hurt, you're fine. If it starts hurting, you're calcium deficient. 96% accurate. Now, in a blood test, the most important one is the ionized calcium in the blood. And, of course, the other is the total calcium. And I need to know both. The ionized calcium is most important because if you're in the reference range, then you do not have a calcium deficiency. And if the calcium is normal, then you've got plenty of vitamin D because that's how the calcium got there in the first place. So if your calcium levels are normal, your vitamin D levels are normal. And I'm really trying to modify the hysteria that comes with these vitamin D tests and make you aware of the real danger of taking too much of the synthetic or even the natural vitamin D3. Because a true vitamin D3 deficiency is a terrible thing. I mean, I've already mentioned the symptoms of vitamin D deficiency several times. But if you live inside, no sunlight, you're playing video games all day long, you're avoiding the foods that have vitamin D, cod liver oil, and eating fatty fish, salmon, tuna, things like that, then you could be in a vitamin D deficient state. Now, what are the clinical signs of too much vitamin D? I mean, symptoms of poisoning, because some people, they heard, I started taking this vitamin D and I started feeling better. Well, that person's body to handle vitamin D may be different than the person who just heard them say that. And the person who just heard them say that run out and they take a half a bottle out of some crazy hysteria that somehow they'll feel better by doing it. Within 12 to 36 hours of ingesting that tremendous amount of vitamin D, and it varies with the amount of cholecalciferol that's been ingested, the symptoms of poisoning are seen when the toxic dose of the cholecalciferol induces this very dangerous rise in the amount of calcium in the bloodstream. It starts messing up with the phosphorus levels in the body, and it leads to this widespread effect across many organs. Toxicity can be seen with the ingestion as little as 20 grams of possum bait. Now, you're not going to run out and eat possum bait, but look at the possum bait at your local country store, your farm store, and look how much cholecalciferol is in there per ounce of dose, and see if that's not what you're taking in your vitamin D3 supplements. Now, the clinical signs of cholecalciferol, vitamin D3 toxicity include, but are not limited to this: lethargy, decrease or loss of appetite, nausea with excessive drooling, vomiting, there may even be blood in the vomit, diarrhea or constipation, there may be blood in the stools, and altered or increased thirst, altered or increased urination, weakness or sudden incoordination with the muscles, excessive twitching or muscle tremors, seizures and convulsions and abdominal pain. Again, I don't want to scare you, but I have patients who've done this, who heard from some lunatic take these massive levels of vitamin D3, and all of a sudden this is what happens to them. In many cases, in less than 2 days from the time they ingested it. Now, for cramps, if you do have muscle cramps, you can use Cataplex F because the calcium is still in solution in the blood, and the body can easily break all that down and get it out of the blood into the tissues. That's one of the best things for restless legs. We have a podcast on that. But if the calcium has already precipitated into a solid, like a kidney stone or plaquing inside the arteries of the heart or somewhere else in the body, then it's no longer free-floating calcium, and so you start using phosphate liquid. It'll directly attack the calcium deposits because the calcium and the phosphorus want to bond to form calcium phosphate, and the liver will take that out of the blood and get rid of it through the bile and eliminate it through the colon. But if you have calcification in the kidneys, you need phosphate liquid to break that down and Cataplex AC to heal the hardened kidney. Cataplex AC, which is whole food vitamin A, whole food vitamin C. We're not talking about beta-carotene. I'm not talking about ascorbic acid. I'm talking about whole food vitamin A and C. For hardened kidneys or for hardened arteries, you want to take 3 or 4 dropperfuls a day of phosphate liquid and about 8 to 12 soybean lecithin tablets or capsules, which is very strong in phosphorus as well. So it's a great 1-2 punch. Take about 4 to 6 weeks. And yes, these things can be reversed. And yes, these things can be addressed by more than just stopping the high vitamin D3. And again, it's just, I was in my dentist the other day getting this crown fixed. And they prescribe 50,000 units of vitamin D3 to somebody that's got loose teeth without ever doing a blood test to determine what the real problem is. So high dosage for a severe kidney stone attack, and I got an extended member of the family doing that right now. You can take up to 12 dropperfuls a day of phosphate liquid. You break that into 3 or 4 doses, but to take this high of a dosage, it's very important to balance out the calcium-phosphorus ratio by taking 3 to 4 calcium lactate tablets away from the phosphate liquid. If you put them together, they're going to marry. You don't want that. And you do that a couple times a day through the day, and like at night, like at night or afternoon or in the morning, just away from phosphate, so you balance these minerals out. The hydroxyapatite mineral combination that's in your bones is mostly calcium and phosphorus. There's some other things there, but mostly calcium and phosphorus. Calcium and phosphorus look at each other like Romeo and Juliet, and you can't keep them apart. But so you have to introduce them in a body separately, which is what I just explained. You don't want them fighting with each other or colliding together in the gut. And you won't run into problems with high phosphorus if you take calcium lactate to balance it out. And also take the soybean lecithin away from the calcium. Just take it with the phosphate liquid. So let me recap, because we're getting on to an hour here. I started off with all these scams and all this excitement, and vitamin D is just another one. But these medical prescriptions given for vitamin D today are just deadly. That's why I'm so concerned for you. Just as an overdose of vitamin D, cholecalciferol, is to an animal, so can synthetic vitamin D be to you. And remember, a vitamin D test by your doctor is incomplete without knowing your serum calcium and your ionizable calcium and your phosphorus levels. It's just like if you go in and do a thyroid panel. They don't just check one thing. They check a half a dozen different things relative to the thyroid gland, so they have a better idea of what's going on. So if you'll take our symptom survey at forbiddendoctor.com to find out where you are, it's free. And in the meantime, stop taking your vitamin D supplements and heal those kidneys with Cataplex AC, cod liver oil, phosphate liquid, Cataplex F, calcium lactate. And you can do the survey. You can get a free 30-minute consultation concerning your results. You can talk directly to one of our nutritionists with no obligation to you. You can stop it right there, or you can go on. If you go on, of course, there's a charge, but up to that point, there isn't. Or you can call the office at 801-523-1890 and order directly over the phone. But it comes down to this. Are you deciding your vitamin D dosage based on numberosis? In other words, you're suffering from the numbers on a blood test rather than any real symptoms. In other words, the DEXA scan or the blood test. Or are you actually suffering from low vitamin D, which is very rare, that manifests itself as low blood calcium symptoms, such as muscle spasms, muscle twitching, muscle weakness, cold sores, restless legs? You have to understand that that's not really a vitamin D deficiency. It is a calcium and vitamin F deficiency. How's that? Boy, that brings us up right to 1 hour. So, the statements that have been made in this podcast about specific products have not been evaluated by the United States Food and Drug Administration, the FDA, and are not intended to diagnose, treat, cure, or prevent disease. All information provided or any information contained on or in any product label or packaging or this podcast is for informational purposes only, and it is not intended as a substitute for advice from your physician or other healthcare professional. So thank you for listening to this Forbidden Information and our Forbidden Podcast. Join us next time for another in-depth discussion of forbidden knowledge, and we will see you then.
Thank you for listening to the Forbidden Doctor Podcast. If you are curious about long life energy enzymes or ageless thyroid, you can purchase them without a membership from our website at forbiddendoctor.com Or get our enzyme formula from Amazon.com by searching the full term, Long Life Energy Enzymes. Don't forget to take our obligation-free symptom survey to get a free personalized supplement protocol recommended for you by Dr. Jack, Mary, or one of our qualified nutritionists. Take the survey, get a call from our nutritionist to create a protocol and a patient login, then use that login to see your own personal protocol along with any favorites you've saved from our symptom library. Remember, our website and our clinic are here for you always.